A 39-year-old man has become the first person to die from the novel coronavirus in Hong Kong. He'd returned to the city from Wuhan last month. 2 more people have also tested positive for the virus, bringing Hong Kong's total number of cases to 17. Both the patients didn't have any recent travel history to the mainland and are believed to have been infected locally. Macau, meantime, has announced it's shutting all casinos for 2 weeks to try to curb the outbreak. Roland Lim has more.
Yes, a spokesperson for the hospital authority says the victim was a Hong Kong resident. He traveled to Wuhan on January 21st, returned to Hong Kong via the high-speed rail on January 23rd. Now, he's identified as the 13th positive patient of the coronavirus and had underlying health issues. That's according to information previously provided by the Center for Health Protection. Now, the CHP says that the man had not visited any healthcare facilities, wet markets, seafood markets on the mainland, nor did he have any exposure to wild animals. However, on his return to Hong Kong, the man suffered from muscle pains and then came down with a fever on January 31st. He sought treatment at the Queen Elizabeth Hospital and then was later moved to an isolation ward at Princess Margaret Hospital after the coronavirus infection was confirmed. Now, his condition deteriorated Tuesday, and the hospital authority confirmed that he suffered from a sudden heart failure at 10:30 a.m. Tuesday. The victim was a resident at Whampoa Gardens. That's a major residential development in Kowloon, and he's also responsible for the first case of a local transmission in Hong Kong. His 72-year-old mother is believed to have caught the virus from close contact with her son, and she's now been isolated as the 15th victim in the city. Now, she hasn't recently traveled out of Hong Kong. They both lived in Block 1, Site 11 of Whampoa Garden. Now, the death of Hong Kong's first victim, of course, comes at a time when public health workers have gone on a 4-day strike here. The trade union, the Hospital Authority Employees Alliance, wants the government to completely shut down the borders with the mainland in order to prevent the spread of the coronavirus here. Some 9,000 health workers at public hospitals walked out on Tuesday. The Hospital Authority is urging patients with mild symptoms or illnesses to visit private clinics instead of the public hospitals, saying that emergency services have been seriously affected due to the absence of a large number of their medical staff. Meantime, nearby Macau, its chief executive, Ho Yat-seng, has ordered all casinos in the city to close for half a month, 2 weeks, on fears of more cases. It's already reported 10 so far. Mr. Ho said that general public services are also temporarily being suspended, with only emergency services to be provided. Now, public transport is also to be scaled back. Meantime, ferry services between Macau and Hong Kong has already been suspended as well.
China says its death toll rose by a record 64 from the previous day to 425. There are now over 20,000 confirmed cases of the novel coronavirus in China.
Well, many of the new fatalities came from Hubei province, the epicenter of the outbreak. Our correspondent Lynette Lim is following developments in China, and she joins us now with the latest. Lynette, with the number of cases still rising, what measures has China announced to contain the outbreak?
There were a number of new measures announced by China's National Health Commission on Tuesday, all of them targeted at dealing with critically ill patients or severe cases. Now, one of them is to require Hubei province, the hardest hit province, to increase the number of designated hospitals for critically ill patients. Now, one major problem is that critically ill patients have not been getting adequate care, as there has been a lack of intensive care facilities and specialists dealing with intensive care. So this is one measure. The other measure is that there will be centralization of these critically ill patients in 3 or more designated hospitals, and a new one will soon be built. The issue in Hubei is that it's not just the sheer numbers, but that a lot of the patients, due to the lack of intensive care, have been dispersed in some 20-odd hospitals across the province. So this is a problem when it comes to trying to contain the epidemic. There will also be human resources, medical workers mobilized from all across China to support the work in these new designated hospitals. And hopefully these actions can arrest the death rate that we're currently seeing in Hubei and Wuhan.
Yeah, speaking of the death rate, we saw a jump of 64 today, new numbers sort of added to that total. What challenges are the Chinese government facing at this point in time?
Yeah, indeed, in a recent report, the Chinese top leadership admitted shortcomings and deficiencies in response to the viral outbreak. Many critics have focused their criticism on how early on a lot of the work was done on suppressing information with regard to the epidemic, instead of suppressing the epidemic itself. The challenges now are immense. Earlier, I talked about the lack of intensive care facilities. This is especially acute in Wuhan, where in the early stages, there were only 110 beds for critically ill cases, and that's a drop compared to, what we are currently seeing as thousands, just over 6,000 cases in Wuhan. There's a lack of medical masks, protective medical clothing for workers, N95 masks, for example, and these and in an anecdote provided by the National Health Commission, in order to conserve supplies, some medical workers are actually going without food and water for up to 9 hours just to be able to keep the protective gear for as long as they can. And in the greater scheme of things, we have seen how fast the government has responded to set out some very sweeping measures to lock down, cities of millions of people. But the devil is in the details of implementation. For example, the logistics supply chain is now crippled, and this has led to a shortage of supplies, not just to medical workers, but to industries, animal feed. Farms have had to bury hundreds of thousands of chicks because they could not access animal feed. In other cases, pregnant women, for example, have not been able to access their hospitals because these hospitals have been converted to designated hospitals fighting the virus outbreak. So there's an issue in accessing primary health care in critical moments like these. There's issues with a lack of harmonization of medical records, and all these implementation details and how the government will tackle these implementation challenges are really what we're seeing at the moment.
Yeah, certainly are many challenges ahead for China and for all of us. In fact, Lynette Lim speaking to us, China correspondent.